Hello, this is week 7 discussion board, and we were asked to read the article by Cassidy K. Wood, 2019, and discuss what you learned. Be specific. Ask 2 questions based on what you learned from the article. I found many things to be interesting in the article, but specific things that I learned more about the usage of telehealth and the percentage of the ACEs in rural communities. On page 11 of the article, it reads, in rural areas, telehealth is often used to link clients with psychiatrists, psychiatric nurse practitioners, or physician assistants, and counselors such as social workers. These links may occur in settings such as community mental health center offices, hospitals, doctors' offices, prisons, long-term care, assisted living facilities, or increasingly in the consumer's own home, as cybersecurity measures improve and HIPAA-compliant software develop, especially for healthcare providers, become available. Previously, I worked in 2 different positions. One was providing case management in an outpatient setting, and another one is I worked with the mobile crisis unit in East Tennessee, and I provided crisis assessments for individuals who were at the emergency department for opioid use. I primarily used telehealth in both of these positions, and I did not realize that telehealth has been around since the 1950s. I do see the use of telehealth has grown significantly, specifically since COVID-19. And I see the benefits and the impact that it can have on the future of social work practices. In both of these roles, I seen that telehealth was very, very beneficial. I was really able to cover a lot of ground in a shorter amount of time and see individuals perhaps in rural communities that were not able to get out. So it was very, very beneficial. Another thing that I learned in the article is the impact and the percentage of the ACEs score in rural areas. In the article on page 2, research on adverse childhood experiences, ACEs, has identified that over 50% of rural residents have experienced at least one ACE. Approximately 10 to 15% have very high ACE exposure, having experienced 4 or more of these events in their lifetime. I did not realize that this percentage was that high. I've provided education groups for the ACE test, and I have given the ACEs test to clients in the past. However, the correlation between a high ACEs score and mental health did not come as much of a shock to me because when children are exposed to trauma or neglect, the brain development may shift and cause stress-related responses. Later in life, this could increase general anxiety, PTSD, or depression. And these are 2 things that I have learned. My 2 questions are, in the article, it discusses how there is more of an emphasis on medical approach than emotional well-being. Why? Why is there more focus on medical services rather than emotional wellness, considering the physical health may be impacted by emotional and environmental health? Second question, considering the ACEs percentage is high, how can we as social workers help to break generational patterns to help prevent generational trauma experiences in rural communities. And that is what I have. Thanks.